Good afternoon, folks. This is Chi Baker from Street Tactical Integrations, offering internal and external martial arts for self-protection and healing. Today's topic is shoulders. In fact, it's more about shoulder injuries. And this is a response out of a fellow surfer's post on Surfing in Oregon Facebook page who has injured his shoulder and is trying to keep on surfing. And his question was, what can he do for it? And so I'm going to provide some information. I'm not a doctor. Please talk to your physician, medical provider, after you hear this video to see if it's right for you. So by no means am I a medical provider telling you what to do to rehab your shoulder. I'm offering you simply advice that I've heard from other medical providers, other PTs, as well as just my own investigation on rehabbing my own shoulder. So I was a high school wrestler and did a lot of damage to my shoulder. I also did a lot of BMX biking and mountain biking back in the day and was a pretty avid rock climber. And so I've kind of done a lot to my shoulders, and they've struggled over the years. And I've found one specific exercise that really helps me rehab my shoulder and be very preventative, which I'll share with you in the next video. Then I'll have another video that is kind of a much longer video on working out and developing the shoulders and doing some rehab with shoulders and back and maybe some core that you can hit me up on and for purchase for like, I don't know, $10 or something like that. Okay, a little bit about the shoulder. So shoulder injuries, lots of times people, particularly us, so I'm 47, a lot of us who are getting older, we've got a lot of wear and tear on the shoulder, again, from sports, from other injuries, from just getting old. And so one doctor's kind of diagnosis, name for it is just 40 old man shoulder, okay? Now, I think it's true that particularly men who have been active, people who maybe because of jobs. So I also have worked as a carpenter and doing landscaping for many years. So there's a lot of in-use wear and tear, whether it's vocation or recreation. And so again, it's this front part of the shoulder, and you can Google anatomy of shoulder and it will show you that there's a tendon that runs right up and down here. And then a lot of shoulder issues actually are in the back too. So it's your scapula and some of the kind of the lat muscles here and some of the attachment points of your shoulder. And it can come from multiple areas. It also can come from posture. So a lot of times people, they're hunching, which actually pulls on these muscles, which strains the front part, ironically. So you've got bad posture. Maybe it's because you're typing a lot, or maybe you just have bad overall posture. So looking at your posture is one thing to really address. Again, both in just how you stand, how you sit, and how you work. And that can actually be a huge game changer in terms of the prevention. And if you have bad posture, it's going to be really hard to rehab it as well. So when you're looking at what you're actually struggling with, I do encourage you or a medical provider or a friend, your partner, to do some palpating. Kind of test out where it is that your shoulder is struggling and look at the surrounding muscles. So you want to look at your pec muscles, you want to look at your bicep, again, you want to look at your lats, you want to look at your trapezoids, and you want to look at your scapular muscles. So check those out, have somebody prod and poke you and see where things are being affected, because sometimes this muscle that's being strained, the causation is actually something that's happening back here. And in the next video I'll take my shirt off and kind of show you a little bit more about the different possibilities. It's a little harder to show with a shirt on, but again, you want to think not just the particular location of the pain. Sometimes that's kind of a distraction pain, meaning that's not the causation, it's just kind of the symptomology of it. So look at the shoulder really as a whole system and then the symptoms that are linked to it or adjacent to it. And that's kind of overall when you're looking at an injury or a strain, is don't just treat the area, treat the whole surrounding area. And that's going to be pretty important. So in terms of a surfer, right, you may have strained this from paddling and kind of strain that front area. You do a lot of push-ups like we do in our martial art class. You're doing a lot on the pec, and you're loading this area right here, these ligaments and tendons, as well as, again, you may have really kind of pulled some of these scapula muscles and lat muscles. So again, after the meat injury, you're going to want to ice this. You're going to want to put some sort of topical on it. I tend to use Tiger Balm. Some people use Aspercreme, Bengay, something my dad used to use. It's kind of an old timers one, but kind of whatever you believe in. I know some people are using CBD oils and creams. They've got shown some validity in injury rehab. So find something that works for you, as well as you can use internal like ibuprofen and things like that to help decrease inflammation. If your muscles and tendons are inflamed, you need to cool them down in order to heal. If they stay hot, it's not going to work as well. Okay, so hopefully this gives you a little bit of beginning about what to look for if you have a shoulder injury. In the next video, I'm going to talk a little bit more about location, and then show you the one exercise that I've come up that has been a game changer.